Stroke, also known as cerebrovascular accident, remains one of the leading causes of death and disability in Vietnam. Every year, we record hundreds of thousands of new stroke cases, and unfortunately, most of them arrive at the hospital too late, resulting in a high rate of death or long-term disability. But what's even more concerning than the severity of the disease is the way we react when it happens. Many people, even while being right next to their loved ones, don't know how to respond properly or follow old folk remedies they believe are helpful, which unintentionally makes the situation worse and causes the patient to miss the golden hour for emergency treatment. The golden hour refers to the first 3 to 4.5 hours after stroke symptoms begin. If the patient is identified early and receives timely emergency care during this window, the chances of recovery increase dramatically and may even prevent lasting damage. So, what would you do if one day a loved one suddenly starts slurring their speech, their limbs go limp, their face droops, or their eyes look vacant? Would you stay calm enough to realize that this isn't just fatigue, but a desperate SOS signal from the brain? In today's video, Live Well Every Day will help you. Identify 4 early warning signs of stroke that can be spotted within minutes. Understand 3 immediate actions to avoid missing the critical chance to save a life, and especially avoid 4 common mistakes that many people unintentionally make during first aid. These are practical and essential insights, not only to protect yourself, but also to help your loved ones in the most fragile moments between life and death. Don't leave just yet, because at the end of this video, Live Well Every Day will also share an important tip. A type of fruit that seems harmless, but can worsen diabetes if consumed the wrong way. Watch until the end to learn how to make smart food choices, to both stay healthy and prevent dangerous complications later on. If you find this content helpful, you can support Live Well Every Day by clicking like, subscribe, and turning on the notification bell, so you don't miss any health knowledge that's easy to understand and apply in daily life. And if you feel today's video was valuable, please drop a number 1 in the comments. If it didn't meet your expectations, we also welcome your honest feedback with a 0, so we can continue improving and serving you better in future videos. First, what to do immediately if you suspect a stroke. 2. Lay the patient on their side, with the head slightly elevated. After calling for emergency services, gently lay the person on their side and prop their head up at about a 30-degree angle. This position helps protect the airway and lowers the risk of choking if the patient vomits. Avoid letting them lie flat if the patient is still conscious. It increases the chance of airway blockage if their swallowing reflex is impaired. Loosen any tight clothing around the neck or waist, and avoid shaking or trying to wake them if they appear confused or unconscious. Stay calm, monitor them closely, and wait for medical professionals to arrive. 3. Remember the exact time symptoms started. Doctors need to know when the first symptoms appeared to decide on the right treatment. If the stroke is caused by a blood clot in the brain, clot-busting medication is only effective within the first 3 to 4.5 hours. If the onset time is unclear, doctors may not be able to prescribe the most effective treatment, which reduces the chances of recovery. That's why noting the time, as precisely as possible, is crucial to saving the brain and the person's life. Dear friends and family, here are 4 things you must never do during a suspected stroke. 1. Never give food or drinks, not even water. When stroke is suspected, do not let the person eat or drink anything. Their swallowing ability may be impaired, and liquids can easily enter the airway, causing choking or even death. Even if they seem alert, they may have lost the swallowing reflex. Only a doctor can decide if they're ready to eat or need IV fluids. A single sip at the wrong time can cost a life. 2. Don't give blood pressure medication on your own, even if readings are high. Many people panic and give the patient antihypertensive drugs. But after a stroke, high blood pressure is a natural response to keep blood flowing to the brain. Suddenly lowering it can worsen brain ischemia or lead to coma and death. Only after a CT/MRI scan can doctors determine the type of stroke and correct treatment. If you're not a medical professional, don't self-prescribe. 3. Don't massage, scrape, poke, or draw blood. It wastes precious time. Traditional methods like rubbing oil, scraping the skin, or pricking fingers do not help with stroke and can delay emergency care. Stroke is a vascular brain injury, not caused by blocked energy or a cold wind. The best help is calling emergency services, not applying folk remedies. Don't let habits take away the chance to survive. 4. Never leave the patient alone hoping they'll sleep it off. Many people assume the person is just tired and let them rest alone. But stroke is an emergency. Every minute means more brain cells are dying. If no one is watching and the patient starts having seizures, stops breathing, or falls into a coma, no one will be there to help. Don't wait. Act. Call for help and stay by their side until medical professionals arrive. Dear friends and family, please remember these 4 early warning signs of stroke. The sooner you recognize them, the higher the chance of saving a life. Apply the FAST rule, a simple and easy-to-remember method. F. Face. Ask the person to smile. If one side of the mouth droops, the face is uneven or asymmetric. It may indicate brain damage. A. Arms. Ask them to raise both arms forward. If one arm is weak, unable to lift, or drops down, it may signal muscle weakness on one side. S. Speech. Ask them to say a simple sentence. If they slur, speak slowly, or can't form words, this could mean the speech area of the brain is affected. T. Time. Call emergency services at 1:15 immediately if you notice any of the above signs. Remember the exact time symptoms began, as this determines whether clot-busting medication can be used. Just a few seconds of observation can save a life. Please share the FAST rule with more people, because with every passing second, millions of brain cells are lost if a stroke isn't treated promptly. Now, dear friends, let's take a look at some groups of foods that may help naturally and sustainably prevent stroke. Besides recognizing the signs and responding quickly when a stroke occurs, early prevention through daily diet plays a very important role. In fact, over 80% of stroke cases are linked to risk factors like high blood pressure, high cholesterol, diabetes, and being overweight. And the good news is, all of these can be controlled through food. Many people habitually eat salty foods, consume a lot of red meat, fried items, and fast food, without realizing that these very foods quietly increase the risk of blood clots and artery hardening, which gradually lead to strokes. In contrast, simple and accessible foods like salmon, walnuts, dark leafy greens, avocados, garlic, and fresh ginger can have very positive effects. They help clean blood vessels, regulate blood pressure, and reduce bad cholesterol, LDL, thereby lowering stroke risk naturally, without having to rely entirely on medication. In upcoming videos, Live Well Every Day will share 7 powerful stroke prevention foods, as well as dishes that are especially beneficial for people over 40, supporting long-term heart and brain health. If you're interested in this topic, don't forget to subscribe to the channel and turn on the notification bell so you won't miss any useful, practical, and easy-to-apply health content. Dear friends and family, as we've just shared, stroke is not something far away or rare. It can happen to anyone, at any time, even when someone appears completely healthy. But the real issue isn't just the severity of the illness, it's how we respond to it. A timely phone call, a proper first aid position, or even simply recognizing the signs, a drooping smile, a weak arm, slurred speech, can make all the difference between a life lived with strength and independence, or one bound to a wheelchair, permanent disability, or loss. Just by remembering the FAST principle, knowing what to do, and avoiding common mistakes during a stroke, each of us already plays a vital role in protecting not only our own health, but also the lives of those we love. It's not just one person's responsibility. It's essential life-saving knowledge that everyone should know. If you find this video helpful, don't hesitate to share it with your family and friends, because one day, your simple act of sharing could save someone's life. And if you value clear, practical, and easy-to-apply health information like this, please subscribe to Live Well Every Day so we can continue this journey together toward living healthier, longer, and more empowered every single day.